My name is Heath Shonhan, National Practice Leader of our Bentleys Health and Ageing Business Unit. As National Practice Leader of our Health and Ageing Business Unit, aged care is one component of that. Healthcare also ranges from everything, including primary healthcare, through to retirement villages, through to medical specialists. So Bentleys has a strong focus on all of those areas. At a personal level, I also have a strong interest in biotechnology, particularly early stage startup companies. We're very lucky to have such a wide-ranging role and a valued role in the sector. Our work ranges from advising the Commonwealth Government on the actual issuing of bed licences through to financial policy and risk, long-term funding changes and impacts on provision of care, advising institutions, financial institutions particularly, either around their credit policies in lending to aged care, reviewing troubled asset positions that they may have where providers have over-leveraged themselves, through to advising the large infrastructure funds on their investments in aged care from a macro level, international businesses as well too, through to actually advising the providers themselves, everyone from the not-for-profits, which make up about 70% of the industry, through to the for-profit providers, through to actually advising the consumers on their entry into aged care. Okay, so some trends very much that we're interested in observing. We have a valued role in the industry, not only as advisors to the Commonwealth Government, but also to many of the large not-for-profits, many of the financial institutions, as well as many of the actual providers. So we're intricately involved not only in policy, but also collecting financial data and sharing industry numbers with everybody. What are we seeing? We're seeing a whole range of things. Consolidation is a big one. So 1,200 providers. Our estimates are over the next 10 years that will reduce down to around 600 providers. Australia has obviously a focus on keeping geographically dispersed, so we can't have all of those 600 providers along the east coast of Australia. The other thing, there's a real strong push towards consumerism and also user pays, essentially people paying for their own care, accommodation and services. This is a little bit confronting for many of our people in our society who have this view that government should pay for everybody. However, government is really just using taxpayers' money. It comes out of our pocket as taxpayers, and so we have a role to ensure that these services are sustainable and efficient. Efficiency is absolutely impacting upon providers. Government is enforcing efficiency dividends. The government is the major funder of aged care. Typically about 70% of money coming into providers comes from the government. Traditionally, that has meant low debtor risk for providers, meaning an increased bankable product, an increased investment appetite into the sector. Slowly, and as of 1 July, a whole range of new funding reforms have come in, though, which mean consumers are going to pay more, and there's a push towards efficiency. Government's paying less. They have less money in the tax office banks, less money being paid by us as taxpayers. It means providers need to stand on their feet more, and consumers ultimately need to pay more themselves. That transfer of funding, though, from provider to consumers means that there's an increase in debtor risk. Providers no longer have the luxury of having money paid by the government directly into their bank account. Now they need to deal in a free market where they need to collect from consumers. Increases their debtor risk. The Bentleys National Aged Care Survey has been running for 20 years. The tagline is better numbers, better decisions. The idea behind the survey is to provide a methodology to enable aged care providers to be able to review their financial performance, but then also to make better decisions around their future financial sustainability. Each year we go out to residential aged care providers around the country. There's around 1,200 of them, and we ask them to share with us their financial data, everything from their balance sheets through to their operating financial statements, through to the underlying activity drivers. So not only the core numbers, but also the drivers of those numbers as well too. Particularly things like room configuration, resident frailty, and affordability of different payment systems. The core benefits are it enables them to leverage our knowledge as a confidential financial intermediary. The benefit of doing that to providers is that it enables them to access the leading wisdom of all the providers around the country and to make better decisions around their long-term sustainability. Ultimately, it impacts upon financial performance and their ability to provide long-term sustainable care to their residents.